Howick is one of the worst affected areas according to the Department of Agriculture. The mass foot and mouth vaccination campaign with a batch of vaccines from Argentina started at a dairy farm with biosecurity controls to fight against the spread of the disease. Several farmers have questioned government's handling of the outbreak, which has spread to all provinces since the first cases were detected in 2021.
One thing that we understand and a thing that weighs on us in this kind of moment of happiness and joy is the fact that this single vaccine doesn't actually give us complete protection. So until our neighbors are vaccinated and the people around them are vaccinated, we are not properly protected ourselves, even though we have been vaccinated. We then need a follow-up dose. We need a booster dose following the initial dose in 6 months' time.
Angry farmers voiced their frustrations during a heated meeting with the minister and officials of the department.
What guarantee do we have in 5 months' time that we're going to get the booster shot? Because it's running throughout the country, we need to know as a producer that we are going to get a booster shot.
And the staff take a lot of strain. They will not visit that at all, because it's just too strenuous for them. So please, could you come and visit a farm where it is active, where you can really see the pain, because you can't deal with the problem if you don't see what the actual problem is.
All dairies are positive at the moment, so we are undergoing huge strain. I would just like to know if the department have got the maths right now, because as a dairy farmer, it's quite simple. You work out how many cows you've got and how much vaccine you require. Unfortunately, I don't think that happened with the agricultural department, because we keep hearing that they brought in 2 million vaccines. Well, with 14 million cattle needing vaccines, that's not anything to be proud of. We needed 28 million vaccines to cover us. Not 2 million. It's too late for us. We're taking strain.
Steenhuisen has defended the massive vaccination strategy, although it was interrupted at the end of last year because the facility in Botswana where vaccines are sourced had an unforeseen shutdown in December.
The key strategy that they came forward with, and the one they've recommended, and the one we've ultimately adopted, is the mass vaccination strategy, so that we can get ahead of foot and mouth disease in South Africa and ensure that we can prevent outbreaks from happening rather than reacting to outbreaks. It's a similar model that was used in Argentina and Brazil to deal with foot and mouth disease when they had a similar situation where FMD was wildly out of control.
Steenhuisen says they've already secured commitments of more than 13 million doses of vaccine for the country. Lo Nkgadebe, SABC News, Howick.